Hi everyone, this is Justin Vaughn bringing you another alert for the hospital community. Today's article is entitled Update to IPPS or IPPS, Changes Beginning in April. Let's begin. In a song released in 2009, celebrated lyricist Bob Dylan used the repeated refrain, "I feel a change coming on." In an earlier era, the late great Sam Cooke assured us that, quote, "a change is going to come," end quote. These remarkable musicians knew that despite the present situation and the seeming status quo, new realities were inevitable. And so it is with the ever-shifting nature of government rulemaking. Changes are always ahead, and certain hospitals will be facing such changes very soon. This section is entitled, The Affected Facilities. Earlier this month, the Centers for Medicare and Medicaid Services, or CMS, published a Medicare Learning Network, MLN, article addressing changes to the IPPS rules that will take effect April 5 of this year. The changes are specifically directed at the following entities that will be submitting claims to Medicare Administrative Contractors, or MACs, for services provided to Medicare beneficiaries. They are as follows: Rural Referral Centers, or RRCs, Medicare Dependent Hospitals, or MDHs, MDH RRCs, Sole Community Hospital, or SCH RRCs, and Essential Access Community Hospital, also known as EACH RRCs. Facilities that fall under these categories should note that the MACs will be reprocessing certain claims based on the changes in the IPPS, which are described in greater detail below. This section is entitled The New Provisions. The following will act to summarize some of the key changes to be implemented next month. First, add-on payments. The changes set for April affect certain payment calculations. Pursuant to 42 CFR 412.88, those are Code of Federal Regulations citations, Medicare makes an add-on payment for discharges involving approved new technologies if the total covered costs of the discharge exceed the diagnosis-related group, or DRG, payment for the case, including adjustments for indirect medical education, or IME, and the disproportionate share hospital, or DSH, payment, but excluding other payments. Medicare's Pricer software will calculate the total covered cost by applying the cost-to-charge ratio to the total covered costs of the discharge. This next item is about drug codes. The changes for April also act to update the fiscal year 2021 IPPS PPS Pricer to allow for up to 10 national drug codes, or NDCs, to be passed to the IPPS PPS Pricer. This will allow for further payment consideration based on new technologies and emerging medical services. Next item is about COVID payments. Section 3710 of the Coronavirus Aid, Relief, and Economic Security Act, or CARES, directed the Secretary of the U.S. Department of Health and Human Services, HHS, to increase the weight factor of the assigned DRG by 20% for an individual diagnosed with COVID-19 discharged during the COVID-19 public health emergency, or PHE, period. CMS implemented the provision of Section 3710 of the CARES Act in CR 11764, and in that same CR, we see established that discharges of an individual diagnosed with COVID-19 will be identified by the presence of the following ICD-10 diagnosis codes: B97.29, and U07.1. You can look up those code descriptors when you get a chance in the ICD-10 manual. The April revision to the IPPS also updates the pricer logic related to the 20% increase to the DRG weight applicable to COVID-19 discharges in fiscal year 2020 and 2021, implemented under Section 3710 of the CARES Act. This change allows Part A Max to update impacted cost reports with the correct hospital-specific rate payment for SCHs and MDHs. Next item involves DSH calculation. The DSH payment calculation has been adjusted so that it will begin correctly applying payment for RRCs and MDH providers with a core-based statistical area location that is not rural. The DSH payment updates are applicable for claims processed between October 8, 2020 and November 2020, with discharges occurring on or after October 1, 2018 through September 30, 2020. Upon successful implementation of the updated FY 2021 IPPS pricer, Max will reprocess claims meeting all of the following criteria no later than June 1, 2021. For correction of the DSH payment, here are the items. Discharge date between October 1, 2018 and September 30, 2020, FY 2019 and 2020 claims. UR and RRC, MDH, RRC, SCH RRC, or Essential Access Community Hospital RRC. Medicare's provider-specific file contained a non-rural 5-digit CBSA code in the standard amount location field at the time of discharge. And then finally, Medicare processed the impacted claims between October 8, 2020 and November 20, 2020. So again, those are the criteria for correction of the DSH payment. Now, for change related to the HSP rate, here are the items. First, discharge date is on or after January 27, 2020, and on or before March 31, 2020, and diagnosis code B97.29 is reported, or the discharge date is on or after April 1, 2020, and the diagnosis code U07.1 is reported. The second, UR and MDH, MDH RRC, SCH, SCH RRC, each or each RRC. And then finally, the impacted claims were processed prior to the implementation date of the updated IPPS pricer. Again, those are the criteria for change related to the HSP rate. Note also that for admissions occurring on or after September 1, 2020, claims reporting condition code ZA may be excluded from the reporting, or rather reprocessing criteria. For a copy of the full MLN advisory, please go to our website, click on this article, and you'll see a link at the bottom, and then you can get the full report. We want to continue to keep you informed and to provide solutions to your business needs. Remember that you can always reach out to us at info@miramedgs.com. Thank you.